So emergency contraception is not just the morning after pill or Plan B. There's 3 others that are available, and you can get them also without a prescription. So in today's video, I'm going to be talking about all 4 methods of emergency contraception, the pros and the cons, and I'm going to be letting you know which one is the best. I'm gonna oversimplify here and say emergency contraception functions to delay ovulation. And how this happens is there's a date where the female body releases the egg, and that egg is available for fertilization. But within or during a menstrual cycle, there is a period or a window we call the fertile period, because the egg travels to the fallopian tube, where it could, if the sperm is available in the female body, get fertilized and conception happens. The sperm can live in the female body for up to 5 days. So even though there's that one day where ovulation is occurring, the egg still travels and the sperm still survive. And if at any point those incidences overlap, fertilization occurs. What the morning after, as an example, does is it suppresses the luteinizing hormone, which means ovulation is delayed, no fertilization. So like I've already said, there's 4 types of emergency contraceptives. 1, Ella, brand name for ulipristal. The second one is levonorgestrel, which is the morning after pill. And then the third one is the copper IUD. And then the fourth one is the Yatspi method. So the Yatspi method is the one where people take their normal pills, the one they use for regular everyday contraception, and they use a lot of those tablets at once to kind of match the amount of levonorgestrel that's available in the morning after pill. So pros and cons, I'm just gonna do one each. 1, the Yatspi method. There's a science to the Yatspi method. There's a way you have to taper down the hormones in the tablet. You have to take it in a particular manner, but you have to do it with your OBGYN, your gynecologist, your general, whoever. Just it has to be done with supervision and with professional help. Also, there's a lot of side effects that people get by using the Yatspi method because of the amount of estrogen that's available in those tablets that you are supposed to use as daily contraceptives. And then number 2, the morning after pill. It's available everywhere, over the counter, and relatively cheap. And yeah, it's not the cheapest, but like I said, in comparison to these other methods, this one is cheap. The con would be that it only protects you for 72 hours, but it's a good method. It's affordable, you have it everywhere, and you can get it over the counter, like I've already said. Okay, so the third one is Ella. The first advantage is that it provides you with protection for up to 5 days. Ella is expensive, that's the con. Honestly, it retails for anything between 250 to 300, and it's not very, that's not very affordable. I mean, it's cheaper than a baby and childbirth, but yeah, it's relatively pricey. From there, in some countries, it's a prescription-only medication. In the countries it's available in, it's not as available as these other options. There's like one pharmacy I know in Lesotho where you can get it. So the copper IUD advantage also provides you with protection for up to 5 days, but you have to book an appointment. You have to have medical intervention for you to get it. So that's a con, because if something happens on Friday, LPPA is closed Saturday, Sunday, and you have to go on Monday. That's already like, because these things, it's best you use them immediately after a mishap. So it just is not very practical. But I think the copper IUD is the best option as an emergency contraception, because like I already said, 1, it provides protection for up to 5 days. It works in duality, where it protects you as an emergency contraception, but as you've already inserted it, so there's protection for months and years to come, up to 12 years, I believe. Lastly, I feel like it's important to also mention that if you are anything above 70 kg, the chances of the morning after pill working the effectiveness is reduced in people who are over 70 kgs. So that's something you need to also mention when you go to the pharmacy and get your morning after pill, is that you are over 70 kgs. Also, morning after pills are not abort efficient. So if you take the morning after pill and you are already pregnant, it will not harm the baby. If you are breastfeeding and something happens and you have to be on the morning after pill or take Ella or do the Yaspi method for 1 week, don't breastfeed your baby. You can still express your milk so that it stays coming, but yeah, you can't be on these hormones and be breastfeeding at the same time. And then obviously, as with any other medication, if you are on other medication, let your pharmacist or your doctor know so that you walk through any interactions or side effects that may occur. There's a host of side effects that you experience with any hormonal treatment: fatigue, nausea, vomiting, headaches, dizziness, all of those. The most common one, however, and the one I want to talk about, is the vomiting. If you are a person who's already queasy or has problems with your GIT, before you take the morning after pill, take an antiemetic, which is medication that helps with nausea or vomiting, that it stops it from happening so that you don't vomit. Because if you vomit within 3 hours after taking any of these medications, they're not gonna work. Thank you so much for staying until the end. Don't forget to like, don't forget to share, don't forget to comment, and we'll see each other back here again next week, guys.